I think this reply guide me to another question regarding microscopical lesions score.
Yes.
Is it always useful and how to apply it?
Um, Lesion scoring is useful in case of suspicion. When you suspect coccidiosis, so it means most of the time clinical coccidiosis, lesion scoring is the only relevant tool because it would give you some information of the parasite, the species, depending on the location, and depending on the intensity of the lesion, it will give you some information of the impact on the birds and the effect, the negative effect it will have on the birds. So lesion scoring is very nice, but lesion scoring is not always easy to do. We need to have in the laboratory some trained people which are used to see all the kind of lesions due to the 5 species that create some typical lesions. And in some cases, for example, with Eimeria maxima and Eimeria brunetti, the lesions, the description of the lesion is not typical for this species. For example, for brunetti and maxima, the description of the lesion score 1, 2, or 3, it's petechia. Petechia on the serosal side or on the mucosal surface. But petechia, they might be due to something else. Sometimes it's not caused by coccidia. So in that case, when you suspect, when you see lesions that look like lesions due to Eimeria brunetti or Eimeria maxima, you need to make sure to confirm with mucosal scraping in that case in order to see that you have some developmental stages of the parasite. And with Eimeria brunetti and Eimeria maxima, the lesions appear at the end of the life cycle. So in that case, if they are due to this parasite, with the mucosal scraping, you will see the oocysts and the large gametes of these 2 species. If you don't find the oocysts and the gametes, if you don't find any parasite, although you have some petechia, it means that they are not due to coccidia. So there are petechia, but I don't know. I don't know what is the cause of these lesions.
If I have a broiler farm with 20,000 birds and I need to do that, do you think how many birds I should take to test and which the best age? You think that I can do this?
Alors, the sample, the larger the sample is, the best it is, of course. But we won't kill all the birds in order to see the lesions. So what I suggest most of the time is to pick 5 birds. 5 birds, it is not linked with the amount of birds inside the flock. Most of the time, if it's a small flock or a large one, 5 birds is, I think, the minimum. And I prefer 5 rather than 4, because if there are 2 with lesions and 2 without, the 5th one will give the balance between the problem or not a problem. But the 5 birds you need to pick must be representative of the status, the general status of the flock. Because some people and some veterinarians says, you pick some sick birds. But if you pick only sick birds, if the flock is not, it's not all the flock is sick, you will know what is occurring for the sick birds, but you don't know what is occurring inside the apparently healthy birds. And the important thing is to know if the apparently healthy birds, they started to multiply the parasite and they might get sick in the next hours or in the next days. Because the problem with coccidia and the problem with treatment is when you put a treatment, you do not treat the sick birds. The sick birds, they already have some lesions, so you can't do anything for them. maybe they'll die, maybe they will recover in a few days, but for them, the treatment will be useless. But the treatment will block the life cycle in apparently healthy birds if these birds don't have lesions or have low-level lesions. So even if they have high-level lesions, they have some lesions before having the clinical signs, so before getting sick. So if you make a diagnosis very fast and then you treat, it's very nice at that time. So it's useful.